Hi, everyone. We're just admitting folks into the room, so we'll get started in just a minute.
Just let everyone know this is currently being recorded.
There are tons of affirmations in the chat, tons of expressing folks expressing that they're excited. If you all can, what I will say is just go ahead, for time's sake, just introduce yourselves in the chat. But hello, welcome everybody to the Building a Sustainable Future for Harm Reduction Funding series. I see folks from Maryland, folks from West Virginia. Awesome. And now I'll hand it back over to Angel and Amanda.
Hi, everyone. I think we can go ahead and get started. And I did see, I think, a question about if this will be recorded. So it is being recorded, and we'll send that out to folks along with a PDF of the slides. And there will be an evaluation at the end as well that will be sent out to folks if you could please fill that out. But Angel, do we want to go ahead and start? Okay. So hi, everybody. I'm Amanda Muller with NASTAD's Drug User Health Team. And this is the first webinar in a grant writing webinar series that we're doing. We're going to have 4 webinars. And this is I Want Money Honey, Grant Writing 101. And the series is Building a Sustainable Future for Harm Reduction Funding. So I'll let Angel introduce herself.
Hey, y'all. So my name is Angel. I use she, her pronouns, and I am a program manager with the harm reduction team at AIDS United. Go on to the next slide. And so as Amanda mentioned, this is the first in a series of grant writing webinars. So in this one, we'll be going over some of the basics of a grant application. And in our next one on July 6th, we will be taking a deeper dive into understanding the reporting, data, monitoring, and program evaluation. In our third in the series on July 20th, we will hear from syringe service programs and about their techniques and their successful leverage of grant funding and how they've managed and navigated the funding available. And then in our fourth and final, we will hear from funders themselves. And they will talk about some of the things that they are looking for and some of that information on the applications and the grants that they send out. And that's on August 3rd.
So our objectives for this webinar today, we're going to go through just the different components of grant applications, how to navigate funding announcements, so some of the key information that's in there and what to look for, and kind of decide if it's a good fit for your organization to apply for. And then do just like a quick review of some grant writing and grant application tips that we have found very helpful in applying for grants. Next slide, please. You can go on to the next one. So just to start, and I'll kind of go through some of these acronyms that we'll be using throughout the presentation. A NOFA would be like a notice of funding opportunity. An RFP would be like a request for proposals. An RFL would be a request for, Angel, help me out here. I hadn't used this one as much.
RFL is a request for LOIs.
Okay, yeah, letter of intent.
Or pre-applications.
So it kind of depends on the funding announcement and the funder, but these are just some common like languages used for, you know, when a grant application is announced. And so some of the information that's on this slide here we'll go through, but these are just some like key information that is commonly contained in these types of announcements. So something that I have found helpful is doing like keyword searches for some of these things, because there's a difference between like federal grant application or announcements, funding announcements, and non-federal like foundation grants. In terms of like the length and stuff. And so for SAMHSA, as an example, some of those documents can be very, very lengthy. And so it's helpful to just do keyword searches for some things to quickly see what some of this is. So typically in these, you would find out how much the grant is for, like how much they would be awarding people, or what the max amount of an award could be if you apply. How long the project is. Is it a one-year grant? Is it a multi-year project? When the application is due. So deciding if you actually have enough time to structure an application and submit it in time and get it reviewed by whoever it needs to be reviewed by, or get input from folks that you need input from. It will typically contain any like required and allowable services and activities. So if you're looking to fund a specific type of program or project, or expand a specific program within your organization, you can do kind of keyword searches to look at like required services or required activities. And there could be a difference between things that are required that you have to do with the grant if you were to apply and get awarded, and then things that aren't required but are still allowable. There is typically funding restrictions and limitations that would be included in there as well. So things that you can't spend money on. So wanting to make sure that you wouldn't be writing anything into your budget or into your proposal that are clearly not allowed to be like purchased or like use that funding for with that grant. Eligibility criteria is a main one. So seeing if your organization is even eligible to apply. So again, you can very quickly just search like eligible or eligibility when looking at a funding announcement as maybe one of the first things to see if your organization is even eligible to apply. It might only be open to syringe service programs. It might only be open to nonprofits. It might only be open to like state health departments. So quickly looking at that. There could be required staff in grant applications. So they might require you to have a project director or other key staff positions that are required. And so kind of determining, do you have those positions on staff? Would you have to hire new folks? What level of effort would they need to be? Sometimes that's dictated in a funding announcement, and sometimes there's some leeway there. They would possibly list data collection and reporting requirements. They might have a required data collection tool you have to use, or it might be a little bit more flexible. So seeing if those would be like super burdensome for your participants, for your staff, would they be a barrier to services? Is there some flexibility there? Instructions on how to submit the application. So there might be certain grant management systems that you have to be registered in, which we'll go over in a little bit. And then formatting requirements would be a very important thing to look for if you've decided to apply and you're going to be structuring an application. Very, very important to adhere to any formatting requirements that they have. Your application, even if you have an awesome proposal, might be rejected or not considered if you don't follow those. So there could be page limits on like the project narrative or the application as a whole, font type and size requirements, margin, 1-inch margin requirements, stuff like that. So really important to pay attention and adhere to those. And I think Angel wanted to go over this pro tip as well.
Yeah, if you are a fiscally sponsored organization and you even think that you might apply for a grant, but you're not sure, talk to your fiscal sponsor right away. In this very beginning, when you find it and you find that you're eligible and you think you might go for it, call them, find out that they're going to be able to accept the grant, or it's within the agreement that you have, and check and see what sort of additional requirements they may have or that you might need from them. So start that talk with your fiscal sponsor right away.
And so just expanding a little bit on funding limitations and restrictions that might be in a grant. I think it's pretty common. I will say I'm most familiar with SAMHSA grant applications. I used to work at our state substance use agency in Florida prior to coming to NASTAD. But I think this is probably pretty common, is that like you can't use funds from a grant to like replace existing funds, so that you can use those existing funds for something else. So like that would be considered supplanting or replacing funds, but typically can use funds to like expand an existing program and show how you would be using these grant funds to like actually expand and enhance the program, or to start a new program if that's like an allowable, if the services you're proposing are allowable. And then there might be some other funding restrictions, like in terms of caps on like certain activities in there. So it could be that you can't spend more than 10% of the total award on like administrative or indirect costs. There might be, restrictions on how much you can spend on like data collection or incentives and stuff like that. So just like important to look at. And then there might be things that are just completely unallowable with that source of funding. So I think one that we're all very familiar with in like the harm reduction space is with syringe service programs. A lot of the times with federal funding, it's like you can't use the money in many instances to actually purchase syringes, but you can use the funding for staff at an SSP and a lot of other services at an SSP. There are some grants where, you can support an overdose prevention program with staff, with training, with materials, but maybe not purchasing naloxone. So important to just kind of look at what those restrictions might be. And then if there's any funding match requirements, like do you have to also match the award that they're providing you if you were to be awarded, or is there no match requirement? And then how the payment or invoicing might be if you were awarded. Is it cost reimbursement? Is it a fixed price contract? That kind of information. And you can go to the next slide. And then was this you, Angel? Sorry. Okay, go ahead.
So talking about grant management systems and applying to them. So see if they have a specific way that you're supposed to apply, whether it's email or if they have some sort of portal that you apply with. For some grant management systems, it can take a long time to get approved. So one example is if you're applying for like a SAMHSA grant or a federal grant, having the ERA Commons number, you have to apply for this and it can take like 6 weeks to get that number. So as soon as you see, the NOFO or RFP come out and you see that there's extra steps in order to apply, such as that number or registering for a system, do it right away, even if you're not sure if you're going to apply for the grant, because you don't want to end up in a situation where you can't apply because you don't have access or the correct numbers to apply. And then also, if you plan to apply with that organization in the future, it gives you a chance to kind of get to know their system and how they take applications. Go ahead, next slide.
So kind of just going over the typical kind of common components of a grant application. And it's going to vary depending on the funder and the grant announcement, but just some common ones that we see. Typically it's structured as like a project narrative and then like a budget or budget narrative. So common sections that are in a project narrative and broken out where you'd have to like answer certain questions would be like a statement of need. And we're going to kind of go over these in more detail, like what populations are you proposing to serve? A project description, or how you propose to implement the project, any evidence-based services that you are proposing and want to elaborate on, your organization's experience and capacity to implement the grant, and there might be a section on like evaluation or data collection and reporting, and then in addition to that, submitting a budget. Sometimes you also have to submit a budget narrative. So kind of justifying each like a line item budget and writing brief justifications for the expenses in there. And then just wanted to point out that there's typically points per section. So for the project narrative and stuff, if it's broken out into different sections, they'll tell you like the maximum amount of points that you can get per section. And it's pretty common too that you can't really like, refer to something that you answered earlier in the project narrative. So making sure that you like directly answer each question that they're asking and not just say like refer to answer, 1A for this response. Like you might have to kind of reword it or, write it in a different way to make it clear in order to get points for that section. I can go to the next slide.
So when you are looking at grants, there's several things that you can just have prepared in advance and make templates and just kind of like plug it in and make some like minor modifications based on the application. So some things that you can have ready to go is your organizational narrative, about your organization. You can just have that. I would suggest creating like a folder that just has your pre-prepared grant components so you can just pull easily out of it. So that organizational narrative, statements of needs, you can have those ready and make some minor updates based on the grant that you're applying for. But it's important also to keep your data up to date. There's nothing worse than going in to write a grant and you also have to go back and update any data that you might have of your own organization and that you want to put in there. So keeping all of that up to date is super helpful and reduces the work that you have to do on the particular grant application. And there's some like attachments that are frequently asked for that you can also just have ready to go in this grant folder so you can easily pull it and not spend time trying to search it or ask different folks in your organization for that information. So like your annual budget with income and expenses, have that ready to go. A document with all of your board of directors, their names, their roles. So if they're the board chair, secretary, their contact info, affiliations, and up-to-date resumes. Not every grant application will ask for all of that detail on your board members, but it's always great to just have it ready so you don't have to constantly ask them for different stuff, and you can just pull and ask for updated resumes like annually from your board. Same staff resumes, ask your staff at regular intervals to update their resumes so that you can have the most up-to-date resume if the grant is asking for that. And then also just having an organizational chart updated and ready to go. And again, I recommend having these all just in like one folder so you can just easily find it and pull it when you need it instead of having to search through all of your stuff to find the individual things. Next slide.
And we're not going to go like super in depth on budget stuff, but we did have like a couple things we wanted to mention. So it is very, very helpful to outline your budget first and then actually write the proposal. So like looking at what the, what services this project can fund, what services your organization needs, seeing if those align, but really outlining your budget in terms of like staff that you might need to hire, services, materials that you want to purchase, and then using that to, even if it's like a loose outline, but a general idea of how much you might be spending or what you're going to be spending with that grant if you were awarded, and then using that to actually write the project narrative and answer those questions, because your budget needs to align with whatever you're proposing in your project narrative. So like we have seen grants before where like everything under the sun is written as activities or things someone might propose to do in the project narrative. And then you look at their budget and it's like, well, they're not proposing spending any money on these things. So it doesn't really line up and doesn't make sense and it can be confusing. So just like a very helpful tip would be outlining your budget first and making sure that, things in your budget are directly tied to what you're proposing doing in the project narrative. Again, like reviewing your budget to make sure you're not proposing any activities or services or materials that are not allowed to be purchased with that grant. Working as a team, so like not having just one person come up with what services and what the budget should be for a grant, but really getting input from, staff, volunteers, participants, like folks that you guys work with. Trying to anticipate changes in costs, looking at actual costs and alternatives that you might need to do if, you either don't get awarded the full amount or costs change. Starting with staffing costs is a good one. So, you want to make sure that you're able to pay your staff a reasonable amount and are actually, paying folks what, the value that they add to the team is. So seeing and being realistic, like not signing a new staff person up or an existing staff person to do like a million activities and then not being able to support them. And then showing a breakdown or calculation of costs. So that might be a little bit more in a budget narrative section. Again, it kind of depends. I mean, some funding announcements have specific budget templates you have to use. So all of this really depends on, what's required by the grant announcement. But showing a breakdown of how you came up with those costs. So an example, and this is not a real example, obviously naloxone prices are very different depending on what product you're purchasing and stuff, but we just kind of use these general numbers as an example. If you were proposing purchasing naloxone with a grant, showing, a little calculation of the cost of each kit and how many kits you plan to purchase, instead of just saying we're going to purchase 20,000 kits or we're going to spend $100,000 on naloxone. Show a little breakdown saying, we're spending $100,000, it's $5 per kit. We're going to purchase and distribute 20,000 kits of naloxone. Next slide, please.
Yeah, so when working on your budget, I have these little examples up here, and something that I found extremely helpful is really getting into the actual tasks you're proposing and breaking it down on all the costs, because I have seen it time and time again. I've done this to myself when writing grants, is I undersell it. I give this project and I don't give enough staff time to complete the project. I don't have enough money towards the resources. And so using this sort of breakdown of all of the tasks that you propose and really breaking it down. So here, let's say you said you're going to create educational materials for the project. You look at each educational material and really think about okay, so for one piece of educational material, we're going to have to do research. It's probably going to take, and again, these are just kind of made up numbers. Please don't use these numbers, really look at your own organization and what it takes to do these things. But so for research, for this education material, it's going to take 10 hours. And I broke it down into weekly hours and project hours, because some things you work on every week, some things it's kind of like a one-time thing for the project. So, and then actually creating the document and all of the time it takes to put all the info in and design it and make it look good, and re-edits and those sorts of things. And then also some time for any revision that you might need afterwards. So you're handing out this document for a while and you get feedback and realize you need to go back and make some changes. So it's making some space for those sorts of things. I also have an example here, let's say in this project, you have in there that you're gonna be doing weekly outreach. And you do 10 hours of weekly outreach. But what actually happens is you're doing much more than 10 hours, right? Maybe you're spending 2 hours a week on preparing, packing, unpacking, shopping. Maybe you're spending another 7 hours on making kits and ordering supplies and making sure that you have the inventory for what you need. And then you're actually spending another 10 hours doing the actual outreach. And then maybe also weekly, you're spending an hour and a half looking at the data you've collected, entering it into spreadsheets or whatever it is you need to do. And then also for the whole project, making some time for the grant reporting that staff member might be doing. And so these are all just staff hours for your 10 hours of weekly outreach. So really ensuring that you don't undersell the amount of time that it takes to do specific aspects that you're proposing. And this will really help too, once you've gone through and you realize maybe we're proposing too much, right? Maybe doing 10 hours of outreach with the grant amount that we're requesting isn't really reasonable. And it helps you set better expectations for yourself as well, and make sure that you're not overworking your staff and expecting them to do, 20 hours of work in 10 hours. Next slide.
So this is just, and I think the next, stay on this slide, but I think the next slide goes over this as well. So in addition to like sections of the project narrative and then like, whatever budget templates and stuff you have to submit, we just kind of wanted to highlight, it would be very helpful to go through the grant announcement and make like an outline or a checklist of all other required documents and attachments that you might have to submit. So it's common to usually have, not as part of the project narrative and the questions you have to directly answer, but other documents or attachments that you have to submit with your application in order for it to be considered. And so these are just some examples. And again, it depends on like the actual funding opportunity and grant announcement, and this will vary by things. So a letter of support or a letter of intent or a letter of commitment might be required, a cover letter. You might have to submit memorandums of understanding with partner organizations. Data collection or reporting instruments that you propose to use might be required to be submitted if you have them. I've seen like informed consent forms be asked for, org charts for your organization, board of directors lists, other policies and procedures they might ask for. It is typically common to have to do like an abstract or an executive summary as well. I know we didn't include that as part of the project narrative, but so just some examples of other documents that you might have to submit. And I think you can go to the next slide. It might elaborate a little bit more. So there might also be like project timelines as like a separate attachment. So maybe like when you need to, if the grant announcement says like services must be implemented by month 2 of the project or month 3 of the project or something. So you might have to submit a project timeline of like, if you're going to be hiring staff, what month are you going to be hiring them by, putting in, if there's required reports, like they say, you have to submit a strategic plan by month 6 of the project. So like writing that into a project timeline, saying you'll submit it by month 6, or a needs assessment. You may have to submit job descriptions of either staff that are going to be working on the project, or positions that you want to hire, or resumes, or biographical sketches of folks that are going to be working on it or that you plan to hire. They might request that you notify certain agencies of your intent to apply. So I've seen that with some like SAMHSA applications, like maybe having to notify the single state agency, like the substance use and mental health agency in your state that you're applying, or maybe a state health department. And they may request other like financial documents or budgets, like an annual operating budget of your organization. So again, this is a long list. It's not that a grant announcement would require every single one of these things every time, but very helpful to like make sure you carefully go through the grant announcement and make like an outline or a checklist of any other required attachments or documents that need to be submitted with your application, and make sure that you don't miss anything. And you can go to the next slide.
Yeah, so getting a little bit more into some of the components of grant applications. So the first thing you might come across is a letter of intent or a pre-application. And these are really just for funders to kind of narrow down the field of full applications that they'll be reviewing. So when you get a letter of intent, or you're writing one, there's some things that you want to keep in mind. You want to be really clear and concise. This isn't the huge, big proposal that you're going to be giving them. It's just really kind of a snapshot of what you're going to be doing. And so you want to make sure it clearly identifies all of the activities, but you don't want to get bogged down in unnecessary details and unnecessary information that you want to save later for your full application. Make sure that you stay within the guidelines that they provide to you, whether that's page length, word count, or formatting requirements. If they don't provide you with that sort of guideline, a good rule is to just kind of stick to one page. If they don't provide anything else in your kind of standard 1/2-inch margin, 12-point font sort of thing. And then also making sure that you format it as a professional letter if they also don't provide guidelines. So with, the date, who you're sending it to at the top, as well as your organization's info, contact info. And then, so the reason that they have these formatting requirements is for equity's sake. So it's important to keep in mind they want to have everyone have an equal amount of opportunity to share information. So when you go over these formattings or don't follow them, oftentimes reviewers might not even consider it or look at that as some sort of unfair advantage because you were able to write more than the other organizations who would follow the guidelines. And then this is your chance to kind of make your program shine and give the funders a sense of who you are and why you're special. Don't assume that the funders know anything about your program or what kind of work you're doing. And you also want to make sure in these letter of intents, especially if they specify that you put in the amount that you're requesting and some information on how you would spend that money. Next slide.
So we were just going to go a little bit more into the different components of a project narrative. So one would be like a statement of need that they might ask for. So this is typically where you would identify and describe like your target populations, what populations you're going to be serving, any specific geographic areas, if there's certain counties or rural communities or, so to be like descriptive and identify that in this section. And it's also where, a statement of need would be documenting like the need or gaps in services that you're proposing to fund with this grant. We gave some examples of just like, and we go a little bit more into when it's beneficial to be vague and when it's helpful to be more specific a little bit later on in this presentation. But if you're, we do say like try to avoid statements that are pretty vague without backing it up if in like a statement of need or if you're trying to document like a gap in services. So an example would be like try to avoid statements, if you're trying to use a grant to like increase access, let's say to like buprenorphine treatment in a rural county or something. And you just write, many people in this county who need treatment can't access it. Without backing that up with any data or information, that's not super helpful. So, you can make a statement like that, but then backing that up with data. So you could look at like waitlist data. And again, obviously it depends like what data you have available to you, but looking at waitlist data, treatment provider capacity in that county, maybe how many like buprenorphine waiver prescribers are practicing in that county, if any needs assessments have been done recently, rates of overdose or substance use disorder or opioid use disorder in those areas. So that can kind of help show the need a little bit more than just a statement that says like a lot of people in this county can't access treatment who need it, which very well may be true. But, if you think about people reviewing your application who might know absolutely nothing about your community, you need to kind of show that. So, and then including citations where possible, if you're citing certain evidence or using certain data sets. And you can go to the next slide.
Yeah, so when we talk about our project description or your proposed implementation, you want to describe the services and activities and how they're going to be implemented. So providing that detail, and I'll get a little bit more into that in the next slide about how you might want to word those things, and include your evidence for your services. Like same as the statement of need, you don't want to provide statements generalized statements without backing it up. And when you're talking about your goals, describe them clearly, make sure that there's measurable objectives in there so that people understand exactly what your goal is. And you want to clearly show how your project is aligned with either the targeted populations or required services or the goals of the RFP, and also aligned with your statement of needs. So for example, if you're talking about, you know, the not having access to treatment in your statement of need, but your actual project is talking about getting people tested for HIV and HCV, it's going to be hard for any grant reviewer to see the correlation of why you've brought up these two different topics. So you want to make sure that they're tied to each other. And over here, we have a little pro tip for using the language that they use in the RFP or RFL, and you don't want to just like parrot the language and copy and paste sentences in there if it doesn't make sense. But when they're calling it, you know, MAT or medicated assisted treatment, you want to use that same language in your grant. But if they're calling it opioid use disorder treatment or MOUD, or, you know, if they're specifically talking about buprenorphine, use that language instead. And so that you want to, it helps reflect that you understand what the project is and that you're going to be doing what they're looking for. But again, you just don't want to like copy and paste and parrot the language if it doesn't fit into your application. Next slide. So looking a little bit more at goals in your scope of work or project description. You hear it all the time, SMART goals. I can't tell you how many times I've read applications and they don't include these components, and it makes it really hard as a reviewer to feel like you're picking a good project if you don't have these specific, measurable, attainable, relevant, and time-based, right? So specific, we'll kind of, when you're writing a grant, I like to call it the art of being specific and vague at the same time. Because you don't want to be so specific that you have put yourself in a position where you don't have flexibility to change what you need to do based on what you find is going on in the community and responding to different sorts of needs or maybe availability. And so I have this example of how to use these SMART goals and being specific and vague at the same time. And again, these are just examples with like random numbers thrown out there. So the example I have for the use is create 5 educational materials within the first quarter. So we've been specific, it's measurable, it's time-based, it's obtainable. On the counter side, something I would not recommend is being so specific that you say you're creating 3 brochures, a social media post on Instagram, and a 10-page pamphlet. Maybe that's your idea going in, and then you realize you don't have that capacity, or that's not really what folks need. And by saying just 5 educational materials, you have that flexibility to decide what types they are, and whether that's social media posting or handouts or webinars, it gives you that more flexibility. And also that do not use didn't give us a time frame when you would create those materials. And again, with the topic that we chose, right, in the using one, I put on the topics related to STI, transmission, treatment, and general education. So that's left us really broad on the topics that we can address with sexually transmitted infections. Whereas the do not use one, it's on the transmission and treatment of syphilis, right? So maybe you've identified while writing this that you think syphilis is really important, but as you're doing the work, you're finding out that the participants of the SSP are actually much more interested in finding out things on chlamydia, and you have trapped yourself in the grant to saying you're just doing syphilis. So using that more broad language of STIs. And then when we're talking about like reaching attainable goals, and the do not use, maybe we think during we do outreach at this location for 2 hours and we can reach 100 people per month. That's all great. And I think that's realistic, but you haven't given yourself enough flexibility. If things happen, maybe you have months where you're not reaching that many people. Maybe something happened and there's like an extreme weather event, and you can't do your weekly outreach for a period of time. So taking that information and making it more broad by saying that you're going to disperse 1,000 copies over the grant period. And then just being more general, saying you're going to do it through outreach activities. So that could be your 2-hour outreach, but maybe you're also going to be doing it at drop-in or social media or at some sort of public event. And so kind of broadening where you can do it, even if you really think you're only going to be doing it at your weekly outreach. You want to give yourself that opportunity to be more flexible in the future and respond. And so that's kind of what I call being specific and vague at the same time. And that you can see we've gotten really specific about the things we're going to do, but we've allowed ourselves a lot of wiggle room throughout the grant period and how we're going to do it. Next slide.
So just going a little bit more into a section that might ask you to, describe your organization's experience or capacity to implement that project. So you can provide a brief description of your organization's history and experience implementing similar projects and services to the one that you're applying for. And then in terms of your capacity as an organization to implement the project, you can clearly identify staff positions that will be implementing the project. And include, and it could be, you don't have to cite them by name, but just the staff position that would be implementing or partnering on that project with you, and describing their roles and responsibilities as it will be related to the project. And if you're hiring new staff, say you don't have those positions, but in the budget for this project that you're applying for, you're proposing hiring a patient navigator or, an outreach coordinator or something, in order to expand your organization's capacity to implement the project. So you can explain that and then identify what the new staff's roles and responsibilities will be related to implementing that project. And you can go to the next slide. And then if you are partnering with any organizations to implement the project as well. So this is a way to enhance your organization's capacity and experience to implement the project, because maybe you don't have that capacity, but you're going to be partnering with other community-based organizations for certain aspects of the project. Identifying each organization and including their roles and responsibilities directly related to the project. And the experience of each partner organization in providing these services. I don't think these have to be super lengthy. I mean, you might not even have that much space depending on if there's formatting requirements for different sections or page limits. So not needing to include a bunch of fluff information, but just being pretty specific in what they're asking for. So we're partnering with such and such organization. They've been providing such and such services to this community for this many years. As part of this project, they're going to be doing these things, and just being pretty specific. So, you might have to include letters of commitment from partner organizations that you're going to be partnering with on the project. And so just wanted to kind of note the difference between a letter of commitment and a letter of support. And again, it depends on the grant announcement if they accept letters of support, if they ask for letters of support, if they ask for letters of commitment. So it depends. If, a letter of support would really just be an organization being this is us and we super support this organization applying for this grant. They do such great things for this community, blah, 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 blah. A letter of commitment would be we are going to be providing these things in order to ensure this project's success. So a letter of commitment would be more specific and making sure that it includes the roles and responsibilities of that organization, that partner organization, specific to this project, and how their partnership is going to help make the project a success. And again, I mean, this would be in the grant announcement if they accept letters of commitment, if they require them from partner organizations, that kind of thing. Next slide.
Okay, I'm not going to go into huge detail on this because our next webinar in the series is going to dive into this stuff much more, but we do want to at least talk about it a little bit and keep it on your radar, especially if you're not able to attend the next one. But keeping in mind when you're talking about evaluation, data collection and reporting, check that RFP or the notice of funding for any required data collection tools they might have or specific outcomes they want measured. Again, using that search tool in the RFP to help look for keywords like data, evaluation, outcomes, to kind of narrow that down. And describing how your data will be collected in that portion, what sort of data tools or instruments you all use already, and what data systems will be used if you all are using something like RedCap, but in the field, your folks are going out with surveys that they keep track of things. And also identifying which staff will be responsible for your data collection and analysis and reporting. And again, I will say include the time in your budget for your evaluation and data collection and reporting. Make sure you include that in the paid staff time because this stuff takes more time than you think, always. Next slide.
So we just wanted to kind of review some of the things we went over and then some tips that we've mentioned or maybe haven't mentioned yet for writing an application. And then I don't know if we mentioned this before, but we'll have a good amount of time for questions and discussion. So, when looking at a funding announcement, finding, trying to determine if it's a good fit for your organization, do the required services and activities and stuff align with what your organization and participants need? Do you have enough time to put together an application and submit it based on when the deadline is? Is the funding worth it? Is it extremely burdensome for not a lot of funding? Or is it going to help enhance an existing project or start a new project that you really need? And it's, going to be a multi-year project. So, first determining if are you eligible to apply? So looking at that kind of stuff. Again, registering for any required grant management systems that you would need to be registered for in order to submit an application as soon as possible. Some of them, as Angel mentioned before, might take a really long time in order to register and be approved for. And as mentioned before as well, if you might apply for funding with an organization in the future, but maybe they don't have a funding announcement out right now that you want to apply for, you couldn't apply in time, but maybe you want to apply for one in the future. So Sam said that was an example, I know they just had their first kind of harm reduction grant, but maybe they'll be releasing more later on. So if you think you might want to apply for it, it would be smart to register for their systems now if you can. So that's one less thing that you have to do and worry about when a funding announcement actually comes out. Following all formatting requirements, again, just making sure that your application wouldn't not be considered or get rejected for formatting stuff. And with their grant management systems too, you might have to submit everything as separate attachments. There might be specific naming requirements for the files that you upload. You might have to convert everything to PDF. So submitting things early and giving yourself time in case you get error messages or warning messages when using their systems, because you might need technical support when submitting. Again, reviewing all required services and activities and any funding restrictions, making sure your budget is if you're thinking about somebody reviewing this who has no idea what your organization is and what services you're proposing, making sure your budget is clearly tied to any services and stuff that you are proposing in your project narrative, and making a checklist for all other required attachments and forms that they may require so that you don't miss anything. And I believe Angel was going to go over the pro tip as well.
Yeah, so this is something I have found extremely useful in many ways, not only to figure out if you're actually qualified, but calling your funder and seeing if you're a good fit, right? Call them and ask them, you know, we want to see if we're a good fit. Tell them a little bit about your project, ask any questions you may have. This does a couple things. Is it can help you figure out if the project you were thinking was a good fit or if you need to redirect and kind of reassess what you were doing. And also it puts you in the mind of the funder and it helps them get excited about your project. And when it comes down to review, it might help them stand out a little bit and have a little bit of a better understanding of who you are as an organization that might not have been easily conveyed on paper.
And just going over some more tips. So doing a keyword search when the grant announcement comes out. Again, these can be super lengthy documents, depending on, you know, certainly federal ones I think are like seem more complex and complicated. So doing keyword searches for things like eligibility and application deadline and required services and stuff like that. And then also, I mean, something I have found helpful, like if you're like trying to see if like naloxone is allowed to be purchased, or, you know, syringes or drug checking services or fentanyl test strips or something, like you can just do very quick keyword searches for those things as well to see if those are allowed, required, restricted, you know. Being familiar with which data sets are available to your organization. You know, it would be best to use if possible. And again, like this depends on what's available to you. It's always best to use like local data. If you don't have access to local data for some of those things, then state data. And then if you don't have access to either of those things, then national data. But also, you know, noting that in the project narrative. So say they asked for data on a certain thing and it doesn't exist. You know, I think something in Florida's like substance use treatment system, I think that they like at the time did not collect information on gender identity, but they asked about it in an application we were writing. And so we had, instead of just like not addressing that piece and just not including it, we had to say that like this data system does not actually collect that information. So, you know, if you don't have it, also maybe explain that it doesn't exist or it's not collected. But being familiar with which data sets are available to you, whether you have to request them from like the state or other organizations, or and trying to have updated data maybe on like an annual basis if possible, so that you know, when you go to apply for something, you're not then having to make a bunch of data requests and wait for those to be sent to you. You know, building partnerships and relationships with other organizations. This could be very helpful. If maybe your organization doesn't have the capacity to like manage a grant, but you can partner with one who can be like the actual applicant, and maybe they would give you a subaward or vice versa, or help expand your organization's capacity to implement a project. Keeping updated policies and procedures, you know, staying updated on your organization and participants' needs. So, you know, maybe through an annual needs assessment or a point in time survey or something, so that you can show when applying for something that, you know, this is like recent information. And I think it would also be helpful, Angel had mentioned this before, like having some documents that are just kind of ready to go and might just need to be edited a little bit, you know, or yeah, edited a little bit to like fit an organization or a funding announcement. So like if there's a program or a service that you like really want to fund, you can like do like a statement of need and a write-up and stuff like that. And then like as grant announcements come out, you might already have that information for a certain program or project that you want to fund ready to go, that you might just need to like format specific to a grant announcement. And then signing up for different like email listservs or something of funders to get grant announcements as soon as they're released. So researching different foundations or federal organizations that you might want to receive funding from eventually, and signing up from for like, yeah, their announcements or listservs, so that you are kept in the know when these are released pretty quickly. Next slide, please.
And then just a couple more tips. And again, some of this is a little bit of a repeat. But start early, talk to your partners, your staff, your board, and the funder all early on in the process. Attend any webinars that the funder is hosting. Oftentimes it's just them reading you the RFP in a PowerPoint style, but what I found really helpful is either someone else will ask a question that is something you might not have considered, or they might give you a little piece that's not in that RFP that's going to help you with your grant. Proofread your grant. And I would suggest, if you can, ask someone trusted outside of the organization or who didn't participate in the grant writing to do your proofreading. Because one, this will not only find those like spelling errors and grammar errors, but they're going to be able to come back with some feedback of if things weren't clear or didn't make sense. And it'll be a little bit more like having a reviewer read it, because they'll be able to tell you those sorts of things. Like, you talked about this piece of the project and I don't really understand this. Like in your statement of need, I don't understand why that's related to the rest of it. So having someone who didn't participate in that grant writing is really going to give you that view that you might not have after spent so many hours looking at the same paragraphs. Make sure you answer all parts of every question. Don't skip over anything. Reread the questions and your answers to make sure that you haven't left anything out. Make sure your timeline aligns with the funder's timeline. So if they're going to be sending out payments and the grant starts at a certain time, make sure that you're able to start the project relatively soon and that you're able to wrap it up within the time they want you to wrap it up. And again, start with your budget. Always start with your budget, and that'll really help guide you into what is possible and what isn't possible with the funding available. Next slide. So now we're just getting into the part for you all to ask questions. In case you need it, here is both mine and Amanda's email, as well as the larger harm reduction team at AIDS United and NASTAD Drug User Health. You can reach out to any and all of those emails with any questions you might have about this grant writing. And if we're not the right person or it's not the right email, we'll direct you to the correct one. So now we can open it up for questions. You can type your questions in the Q&A down at the bottom. Is the easiest way to track it. And if you had some in the chats that haven't been addressed, we'll bring them up.
Hey, Angel and Amanda, there's one thing in the chat around, there's a question directed to both of you all. So a lot of times funders tend to fund who they're more familiar with. Do you have any suggestions on how to break that cycle?
Yeah, that phone call, calling them when the RFP comes out, and introduce yourself and your program and kind of put yourself in that space where they already know you.
Yeah, I would agree with that. And I think too, like, I don't know, I feel like we would run into that from like a state, either health department or substance use issue, like state agency issue, in terms of like there's existing contracts with existing providers that, you know, sometimes like they just continue to get those funds instead of giving it to like a new organization or whatever. So like reaching out to, if you're trying to get like state or federal funds as well, I mean, this depends on if you're doing, you know, foundation grants and stuff like that is different, but you know, reaching out to your state agencies as well, so that they know you exist, and, you know, maybe trying to get a meeting with them like before something's even announced, so that you're on their radar as well, so that when they do get funding, you can be considered and have that existing relationship, I think could be helpful.
Yeah, and you can also use any webinars they might have as a chance to kind of introduce yourself. If you want to get yourself known at the webinars, ask a question, like say who you are and what program you're with, and be ready to ask a question. Even if you don't really have that question, ask it anyway. to kind of get yourself out there and at least a little bit known to the funder.
Right. And thank you both. Another point that you all also touched on was also around relationship building, right? Tim also echoed that in the chat, mentioning specifically, you want to go to conferences and seminars you may not think directly apply to you, to sit down at a table where you may know no one. So yes. Also, someone else in the chat mentioned, if you're not used to proposal writing yet, you may find the initial call intimidating or awkward, but it's standard practice for them and a lot less weird than you may think. You may want to approach it like, I just want to see if our values align. So I'm starting to see similarities in the responses. And then Christine also echoed, you can also pay attention to the org description sections you outline and demonstrate how effective you are with related services. That is another great strategy. Are there any other additional questions for Angel and Amanda? Yes, to echo Christine, there are no dumb questions at all. If anyone is holding on to one, absolutely, there are no dumb questions here. This is to assist everybody.
Yeah, and I just kind of wanted to mention as well with the emails that we have listed up here, certainly emails about questions related to this, to this webinar, but also, we provide training and technical assistance on a lot of things just related to drug user health, syringe service programs. We're trying to do some more grant writing TA, so feel free to reach out as things come up that you guys have questions on or might need some technical assistance on as well.
One point kind of circling back a little bit to what Tim had said about getting to know folks, going to conferences, talking to folks, and kind of making yourself known, is you also might be potentially meeting reviewers for grant writing. So even if you're not meeting with the funder yourself, harm reduction is a relatively small world, and oftentimes your peers and your other folks are going to be reviewing these applications for the grants. And so that can help you stand out when reviewers know who you are as well.
All right, let's give it just a second. I think Gwendolyn might have been gearing up for a question around TA.
There are two questions. One's a question, one's more of a comment. Angel and Amanda. So Gwendolyn asks, so what does TA consist of for new organizations that is getting started with CHR programs? Specifically, what does TA consist of? And then another person asked, we are an SSP located in a town of 65,000 with a registration of 253. We struggle with grant writing because we have no pool of qualified people to volunteer. Would you like to respond to any of those?
Sure. So for the technical assistance question, in terms of what it consists of, I don't know if that question is only specific to grant writing. I mean, so this webinar series as well is kind of funded through NASTAD and AIDS United's work through the Harm Reduction TA Center. So that is like from the CDC. that they give us funding to be able to provide expanded technical assistance and training to syringe service programs and health departments. I will find a link and put it in the chat in order to, I mean, you can contact us directly or submit through TA requests through that system. But we really just have like a no wrong door approach to providing technical assistance to like SSPs and health departments related to drug user health. So there are a number of topic areas listed, like basics and getting started with, a harm reduction program, or starting a syringe service program, or best practices for SSPs, or, different policies and procedures folks might need copies of or examples of. So it's pretty expansive, and we do have kind of a no wrong door approach to technical assistance. So if you have something in mind, I would say like to reach out to us, and we'll, we usually do like an initial TA meeting and get more information and kind of talk about how we can maybe help and go from there.
And just to address a little bit about having the no pool of qualified people to volunteer with grant writing, it is a big challenge, even if you have a staff and other folks, to find somebody to do the grant writing. I would say that having those pre-prepared materials and just having your like general narratives and those sorts of things ready to go will really help lessen that burden. And then, maybe looking at it as, instead of figuring out one person to write grants, you kind of take them as the grants come in and have a couple people work on it to lessen that burden and hopefully get some in. It's always a challenge not having enough staff or volunteers or board members to do all the work that needs to be done.
One thing, Gwendolyn, if you could clarify what CHR programs are, I'm not familiar with that acronym. And just to add on to what Angel was saying, if you're looking for volunteers, especially for something skill-based like grant writing, no guarantees, of course, but there is an organization called Catch a Fire that I'm going to put the link in the chat here, that connects volunteers to nonprofits for design work, for grant writing, for those sort of skill like project-based opportunities. And so you might like post something on there when you're not looking for a grant writer necessarily, and see if there's someone who might be willing and available to work with you, learn about your organization, and engage whenever you find that opportunity that you'd like to go for.
Thank you, Christine. Also in the chat, Gwendolyn noted that CHR stands for Comprehensive Harm Reduction. Someone else in the chat, Amanda and Angel, asked about proofreading assistance, not specifically for typos or grammar, but for readability. And is there any assistance around that or resources?
I will say we're probably not allowed to like review someone's grant application specifically. So when like the SAMHSA harm reduction grant was announced and folks were interested in applying and stuff, NASTAD did offer TA, and we did a lot of one-on-one TA sessions with like SSPs and health departments and other organizations who were interested in applying. We could not, which we were allowed to do, but we could not like help someone write their application or like specifically review someone's application, but could, talk about like good tips and if they had questions about the announcement or, good strategies for, like showing your organization's like experience or services you want to fund, and how these applications typically work and stuff like that. I don't think we were like allowed to actually review someone's specific application, but as Angel had mentioned before, I mean, that is a very helpful thing to do. Others might know, I'm not familiar with like a service for that, although that might exist, but you know, if you have partner organizations, or, and maybe not even in your state, but like people in the harm reduction community, um, that would be willing to review your application for readability, that would be like maybe trying to find some folks that you can reach out to for that in the future. But Angel might have more to add on that.
You said what I was going to say.
I would just add, I would echo Amanda. We would have to proof everyone's applications, and unfortunately we don't have the capacity for that, just for equity's sake. There is another organization that like, or service rather, that you know, I've heard it can be a little overwhelming to go through applications when people send them in, but if you've ever heard of Upwork, it's sort of a place where people looking for freelancers can connect with freelancers. Proofreading is a big one. Often a lot of the proofreading jobs are scams. So I think people would love to find actual proofreading jobs. And my sense is that fees for proofreading can range, you know, anywhere up to maybe $35 an hour. But depending on the level of experience, if you just really want another set of eyes, like for, you know, college students or whoever's trying to just have a little side hustle, you might check upwork.com for that and post there. And then quickly wanted to respond to Gwendolyn. Comprehensive harm reduction. Thank you. I've not heard that acronym used very often. It would be absolutely, like, we would love to go on ride-alongs and do that kind of comprehensive TA. Right now, I think, unfortunately, we don't have the funding to support travel and that sort of thing. But, you know, like Amanda said, you can always reach out to the TA Center if you have specific operational questions, or, you know, if we can connect you with folks who have a similar model of program to yours, and chat about sort of how they do arrange their operations or those sorts of things. Like, there are some different strategies that we could try and take in terms of getting you what you need. Yeah, if an agency is willing to pay, we could A, talk about that. B, we could recommend consultants in the field that could do that work if for some reason it were a conflict for us. But I know personally, and a bunch of people who would love to just spend some time at a harm reduction program. And that's one of the best ways to offer TAs, to really see it yourself and be able to provide some of that really in the weeds advice. So if it's not us, I know that we would be able to put our heads together and connect you with someone who'd be very happy and experienced to help.
I see some good tips in the chat from Logan about using online tools to read the document back to you out loud, and having that different perspective and hearing it vocalized can be helpful. And with Jay, is for proofreading is to do exchanges or writing groups with other folks or organizations that are applying for grants. Because yeah, they need it just as much as you do, and so they'll benefit from it as well.
And then Michelle also noted in the chat that you have an open invitation from them. So good.
Yeah, and I'll echo Ashley. Anytime you can hire folks use drugs to help you out, whether it's taking another look at your services and how to improve them, or folks with like a good eye for proofreading or whatever the case may be. Never discount our folks as options for that work either. Thank you for that, Ashley.
Yeah, any other questions? If you don't have them now and think of them later, feel free to reach out. You're not limited to just this webinar for questions about it.
Just in case people are thinking of last minute additions, questions, etc., I'll also mention I have not had the pleasure of poking around this system yet, but Foundation Directory is supposedly a really, really wonderful resource if you're doing foundation research and trying to see sort of what's in your area, what do they fund, what are their priorities, those sorts of things. What have they funded before? It is a paid service, but a lot of public libraries subscribe to Foundation Directory on the community's behalf. So it might be worth reaching out to your local public library to see if they do, and you'd be able to get free access. And I'm seeing a question in the chat. What's the best way to qualify or quantify some of the, quote, developing systems capacity building projects in reporting?
Morgan, can you elaborate on that? If you wouldn't mind. Do you mean like the best way to report on some of those types of projects? Okay, so yeah, you have some systems you're paying to develop and build out. By the time it's time to report, you won't have much to show except that you have them now. I mean, it depends what they're asking for in reports, but I mean, part of it could be like the steps that you've taken to get those systems in place. So without, I don't know, knowing which systems those are, but you know, if your plan is to eventually use them as part of that project, but you had to do like X number of things in order to get those systems in place, then like detailing what those steps were and maybe explaining why like they're not being utilized yet because it took this long to get them in place and you had to go through all of these different steps. So like being detailed about what that took. I mean, we certainly had, I don't know, stuff like that if we propose like implementing a new reporting system or something like that, and then it took like way longer than we originally anticipated to get set up, and we had to do maybe a lot more training of staff, or we had like issues with like maybe the vendor we were using, or you know, getting a contract in place with the state took so much longer, and there were like bureaucratic, I mean, that specific to like a state agency, but you know, instead of just being like, oh, it's not in place yet, we just got it set up, like we would elaborate on and be pretty detailed on like all the steps that have been taken and what the timeline for that was, and maybe explaining why it's not in place yet and things took longer than anticipated, and like going into detail about that. But I'll see if Angel has other things to add to that?
One thing too is before you reach your reporting, as soon as you find out that maybe you're not going to meet the project timeline originally anticipated, to reach out to your funder and talk to them and see what sort of thing they would be okay with if you need to reassess where you're at. Just talking with them about these things. It might seem awkward and weird to call them and be like, you gave me this grant for this, but it turns out I'm not going to get there as quick as I thought, or we're not going to finalize it all in that time period. But, you know, funders hear this more frequently and they would much rather have that conversation and work with you and troubleshoot ahead of time instead of finding out when it's time to report.
Yeah, I would agree with that. I would say, and keep in mind, not every one operates like AU, but for instance, Angel and I just had a conversation with one of our current grantees whose project is a little atypical from what we usually get, and discussed like what reporting metrics made sense and felt good and could reflect their success. And we're going to use those instead, right? And I would really echo what Amanda's saying around like thinking through and like breaking down each step. So like, you know, for example, AIDS United is on our team, we're exploring a new sort of data collection analysis tool. And, you know, steps to implementing that we'll learn about very soon, but include like gathering historical data, identifying, you know, metrics moving forward, uploading historical data, creating forms, like whatever sort of like mini steps there are, breaking those down and like checking those boxes off, whether or not you're sort of in implementation yet.
Yeah, another example, like we had, this isn't like data reporting, but I think one of the projects we had at the state was like we were going to do an overdose prevention awareness campaign about where to access naloxone for the state. And I mean, it got like super delayed for a number of reasons. And in quarterly reporting with our grant, and we had to like continue to just like request it and carry over funding. And we're like, okay, we promise we're going to be implementing it next year. But we had to like, you know, we were pretty transparent about why it was so delayed. And we had like an RFP process that took a long time. Somebody challenged the results. And so that like delayed things. We, you know, so getting contracts in place took longer than expected. So we were just very transparent about that stuff and had check-ins with our project officer that, so when they looked at a quarterly report or an annual report, it wasn't the first time they were hearing about it. As Angel mentioned, like we either sent them an email about it or had regular check-ins where we like gave them a heads up, and so they were in the know about that as well. So I mean, it does happen, you know, and just I think being transparent and then like breaking down those steps and elaborating on why something might be not implemented at the time that you anticipated or said it would be is very helpful. And I mean, I think funders are like used to stuff like that happening.
I want to add that, like, yeah, many funders are used to stuff like that happening. And being transparent is really important, but don't understand that there might be an answer that you don't like. I had a grant once, and we had this thing out of our control happen, and there was no way we could finish it in the timeline that they wanted. We asked for an extension on the timeline. The funder said we absolutely cannot give an extension. They were constrained. They offered a little bit more money, but that wasn't going to fix the problem of time. And so we ultimately had to return the grant because there was no way we could move forward and complete it. And so, you know, that could happen. And the funder might not have flexibility on their end, although that I find is less frequent. Having no flexibility is much less frequent than the other cases, but it is a possibility. But again, it's better to have that conversation early than have spent all the money or come to the end and not spend the money and not met the goals and find out that that's a problem at the end of the period.
Any other questions that we can answer now? I did also just want to mention, we mentioned this at the beginning, but the next webinar in the series will be July 6th from 2 to 3:30. And we will be sending out a PDF of the slides from today's presentation and the recording and an evaluation if folks could fill that out so we can see, what other types of training or technical assistance around grant writing would be most helpful for us to work on and provide to folks.
Thank you all so much. And it looks like we can wrap up a few minutes early.
Yeah, thank you guys so much for attending and participating in this discussion. And we hope to see you at the next one. Thank you, everyone.